My name is Laurens Janssens, and I will be presenting our study titled Fatty Pancreas is Associated with Increased Risk of Pancreatic Ductal Adenocarcinoma, a case control study using whole organ pancreas segmentation on pre-diagnostic abdominal CT scans. We know from prior studies that pancreatic ductal adenocarcinoma is associated with obesity, but the role of fatty pancreas in pancreatic cancer is unclear. There are small case control studies that have shown an increase in intrapancreatic fat in resected pancreas cancer specimens, but it's unclear whether this is a primary or a secondary process. So in our study, we aim to investigate if fatty pancreas is associated with pancreatic ductal adenocarcinoma by using an AI-assisted whole organ pancreas segmentation model on non-contrast CT, and by comparing the mean pancreatic Hounsfield units in patients who later developed pancreatic cancer with age, sex, and diabetes mellitus matched controls that did not develop pancreatic cancer. Here you can see an example of whole organ segmentation on non-contrast CT. This was initially done manually and later on with the help of a convolutional neural network. We then extracted mean voxel Hounsfield units and pancreatic volume from these segmentations. So we collected cases which were non-contrast abdominal CT scans that were obtained prior to radiographic evidence of pancreatic cancer, anywhere between 2 months and 2 years. And we matched those to controls that were matched for age, sex, and diabetes mellitus. So essentially, we developed a case control study comparing mean pancreatic Hounsfield units, pancreas volume, and BMI in those two groups. Here you can see the results of our study. We had 46 cases and 92 controls in a 1:2 match ratio. And you can see that age, sex, and diabetes mellitus are very similar in both groups because of the design of the study. However, BMI and mean pancreatic Hounsfield units were both significantly lower in the cases compared to the controls. We did not find any difference in pancreas volume. When we apply a multivariate logistic regression analysis to this, we saw that the odds for developing pancreatic cancer increased with a decrease in BMI and decrease in mean pancreatic Hounsfield units, indicating that a decrease in mean whole gland pancreatic Hounsfield units is associated with an increased odds of pancreatic cancer. We believe that the increasing odds for pancreas cancer with decrease in BMI is likely a reflection of the pre-diagnostic cachexia that we often see in pancreas cancer patients. So in summary, we conclude that the mean pancreatic whole gland Hounsfield units is significantly lower in the pre-diagnostic phase of pancreatic cancer compared to controls matched for age, sex, and diabetes mellitus. We also note that pancreatic fatty change may predate the onset of radiologically overt pancreatic cancer, although these findings will need to be validated in larger cohorts. And with this, I would like to thank you for your attention and share my acknowledgments.